Hi, good morning. My name is Natalia Melchor, and today I will be presenting my PIA. The topic of today is importance of patient safety and safe surgery. First things first, the diagnosis. Why it's really important to make a good diagnosis? Well, most of the decisions that are related to the treatment or to the procedure that we're going to make to our patients must be made or taken a lot before putting anesthesia to the patient or a lot before starting with the first step of that procedure. It is very important for us as dentists, as students, as surgeons to identify the different symptoms and important backgrounds that our patient has. This includes different diseases or different things that it has. And also, it is important to collect all the information that we got from the different kinds of studies and analysis that we make to or made to our patient. All this information, if we collect it, it can help us make a good diagnosis and a correct diagnosis. If the surgeon or the dentist follows all the steps, it will have all that information that it's needed to make a good decision and decide if the surgery will be a safe procedure or not. If we are going to make the surgery or if we need to start searching for other types of treatment for our patient. Because, of course, this depends and all the background, the analysis that we make, and all the information that we got from that. It is different in every patient, of course. Now, let's continue with the basic needs. The basic needs of what? The basic needs to have a safe surgery. Well, there are two main groups that are visibility and professional help. We're going to start with visibility. First, sufficient access. What does this mean? Well, of course, we need to have all the access that we need to be working in a comfortable way. Second, good lighting. Of course, we cannot start the procedure if we have the visibility, if we can't see all the injury, all the part of the mouth that we're going to be working with. And third point, liquids free surgical field. It is really important before starting the procedure to check and to verify that our surgical field is in good conditions and it's how it needs to be. Second group, professional help. First, trained personnel. The people that are helping us, that is around us, needs to be trained, needs to have the abilities, the knowledge to be there, that it's needed to help us. Of course, it needs to be trained in the topic. Second, knowledge of the procedure. It is our responsibility to be sure that we know all the stuff that it's needed about the patient and about the procedure and about all the things that can be wrong or can go wrong during the procedure. This is our responsibility. And third, needs anticipation. What does this mean? Well, before starting, we need to be prepared with all the knowledge, with all the tools, and the knowledge about the procedures that maybe will be needed during the treatment. We need to anticipate everything that will be may needing so we can be prepared if something goes wrong, and we can be prepared with the instruments that we need and with the knowledge that we need to help the patient. Now, we're going to finish this topic with the aseptic technique. Well, the aseptic techniques are really important because they help us to eliminate all the contamination, all the bacteria, all the pathological microorganisms from the wound of the patient. The main goal of these aseptic techniques is to maintain the patient, first of all. Second, the healthcare personnel that include us and the objects like the instruments that we're using, the place, our surgical field, everything without any bacteria that can affect the safety of our patient. And it's very important this during the procedure. Irrigate large amounts of liquid under pressure during the surgery. Why? Well, if we do this the water under pressure or the liquid, the solutions under pressure will expel all the bacteria and all the materials that can injury that can be harmful from the wood for our patients. With this, I finished the presentations of the basic topics to have a safe surgery and to maintain our patients safe. Thank you for your attention.